This is very common and potentially a huge problem because these toxins, the more potent ones, can not only mess up the local gut environment, causing things like leaky gut and gut inflammation and so on, but these endotoxins can either cross the gut bacteria, not the gut bacteria, the gut barrier, and get into systemic circulation. Or they can activate the systemic immune system and create systemic inflammation, even though the toxins themselves may actually stay inside the gut. Well, it turns out that when something interferes with bile production and bile release into the small intestine, these endotoxins increase in the gut. So lower bile means more toxins, and adding back bile acids or restoring bile flow reduces the toxin load. How does that work? Well, because bile acids act like sponges to bind to these toxins, which will neutralize them so that you can eliminate them before they have a chance to create some kind of a negative impact by eroding tissues, causing inflammation, or causing local and systemic immune activity.